So the first technique we're going to do is going to be to help patellar tracking. So this tends to be an issue in a lot of people where they'll get pain either right here on the knee, or sometimes they'll get it on the outside of the knee more from the IT band pulling. So usually your kneecap should be moving inwards. It's just fine on its own. Becca's isn't bad, but it definitely could have more motion there. But if it's kind of hanging out over here when you do things that bend your knee, it doesn't track correctly. So we can tape it to kind of hold it in its happy position so that you have less pain when you're doing things like squatting, running, stairs, etc. So we cut a piece of tape that's a little bit bigger than the kneecap itself. And then I like to round the corners so that it doesn't get stuck on clothing. Then when we're actually applying it, we'll rip off about 1 inch to 1/2 inch of the piece of tape, take the backing off. We'll find where her kneecap is. We will stick this with no stretch at all on the outside of her leg. Then what we'll do is we'll kind of get this so that we're slowly peeling this back. I'll push her knee towards the middle, creating that medial glide of the patella. I'll provide about 50% stretch on the tape, run it over top of it, and then just flatten the other side down. And then, as always, rub it in so that it sticks because the adhesive is heat activated. And she should still be able to bend her knee. No problem. Another technique we can do for taping with the knee is often for more patellar pain. So a lot of times people have pain right on the patellar tendon, or they'll just have kind of extra mobility in their kneecap that needs a little more support, or sometimes the pain's more behind the kneecap. So with this one, we're kind of offloading the patellar tendon. We're going to put them in just a little bit of knee flexion so their knee's not all the way straight, otherwise it's going to fall off later. Then for this one, same thing, about the size of from one side of the knee to the other. This one we're going to rip the tape straight down the middle. And so you kind of have two sides almost like a band-aid. That middle part is going to go right underneath the kneecap, and then you'll apply a little bit of upward pressure on either side and just flatten the sides down. Same thing as always, rub it in so it sticks.
If you guys want to see anything specific, leave comments in the boxes below.